AmeriCollect's webinar 501R series on ECAs, or Extraordinary Collection Actions, 501R6. My name is Sean Gretz. I get the pleasure of being your panelist, your organizer, your question taker. I get the pleasure of being everything today. Before I begin, though, on the right-hand side, I just want to give you a little bit of an update of how to ask questions during this session. On the right-hand side, there's a question and answer area in the GoToMeeting panel box. If you click in the question area and ask any questions that you have of me in that chat area, I'll answer them after the webinar if the time allows. So like I said, today's webinar is on 501R6, Extraordinary Collection Actions. My name is Sean Gretz. I'm the Vice President of AmeriCollect. We are the ridiculously nice collection agency, for those that don't know who we are. We've been in business since 1964, and we focus on treating patients the right way. We are a only healthcare collection agency, but that's enough about who we are. One of the things I always like to say is if you're seeking legal advice, make sure you talk to an attorney, because I can't help you there. I am not an attorney. I did not play one on TV last night. So please seek legal advice from your attorney. So for those that joined the 501R webinar series, we've talked already about last week about 501R4. And if you weren't able to join us on last week's webinar on 501R4, it's available to you online at www.americollect.com. Please feel free to check it out. But today what we're going to be covering is Extraordinary Collection Actions, or 501R6. And really, with anything in healthcare, you got to have an acronym for this stuff. I mean, you have to. It's just part of what healthcare is. So what I'm going to talk about today, you're going to hear me say a lot, ECAs. And as a background for this, when I say ECAs, I mean Extraordinary Collection Actions. I may also throw out two other acronyms as well, and that's FAP, which is your Financial Assistance Policy, and then also AGB, which is your amounts generally billed. And you can see on the screen right now, I'm talking about a little bit about the background of the Patient Affordable Care Act, because that's where 501R came from. So when I do say these acronyms, ECAs, AGB, FAP, you may want to refer back to this slide if you have the handouts, so then you can take a look at it as well. And while I'm speaking of handouts, also on your right-hand side, if you don't have the handouts, they are available to you from the GoToMeeting panel. It's just on the right-hand side, and you just have to click on handouts, and you can download them and save them for your convenience. So let's continue on. What are we going to cover today? Well, the first thing we're going to cover is what is an ECA and what is not an ECA. That's the first thing we're going to cover today. The second thing we're going to cover today is what are the reasonable efforts. This is a very important piece to 501R, and you have to understand what the reasonable efforts are. It's a piece that a lot of places have struggled with, and if you need help on what are the reasonable efforts, please feel free to reach out to me. One of the things that I've been doing for a lot of different clients, and I've probably reviewed over 50 different policies, is reviewed billing and collection policies along with financial assistance policies for probably over 50 different facilities. So if you're having struggles writing your policies, or if you want a second eye to take a look at them, please send them my way. My email is on the last page of this presentation, and feel free to ask me any questions you have on 501R. So like I said, we're going to cover what are those reasonable efforts. And number three, the third thing that we're going to cover, we're going to talk about what the application period means and how to define the application period. So the first thing I want to do is I want to thank the IRS. You know, it's important to thank them because they said something interesting. They said that we are extraordinary. We do extraordinary collection actions, and I believe they're right. As a collection agency, we do some extraordinary things. We're remarkable, and if you look at the synonyms, they're remarkable, exceptional, amazing, astonishing, and I happen to agree with them. All those things combined together, it is what we do as a healthcare collection agency. We do some remarkable things for helping patients out each and every day, helping them qualify for insurance, helping them seek additional coverage, helping them find a way to pay their medical accounts. It's important to realize that sometimes you have to thank the IRS for giving such a great name to this, Extraordinary Collection Actions, because we do some remarkable things. So let's dive in. The first sentence of the 501R regulations for the extraordinary collection actions is something extremely important and something you have to memorize. That sentence says this, that you may not engage in extraordinary collection actions before an organization has made a reasonable effort to determine whether an individual is eligible for financial assistance or the care provided. Those two things in red, extraordinary collection actions and reasonable efforts, like I said before, is the majority of this presentation. So what are the extraordinary collections? This is the first thing that I'm going to cover today. There's two main ones. And why I say there's two main ones is because these are the two that most facilities do today. In some cases, you cannot do these in certain states. But for a majority of the hospitals that are listening to this, this webinar, these are the two that a majority that do. Number one, it's reporting adverse information to the credit reporting or credit bureaus. So those credit bureaus are Experian, Equifax, and TransUnion, the three major ones that most collection agencies report. That is considered an extraordinary collection actions. Number two, it's taking legal or judicial action, and it's not limited to A through I below, but those are the main things, legal or judicial action. That is extraordinary collection action. There are several other ones that I'm not going to touch on in this webinar, including that listing with a debt buyer is considered an extraordinary collection action. So if you list with a debt buyer, it is considered extraordinary collection actions. And there's a few other ones that, like I said, I'm not going to touch on. And the reason I don't touch on them is because most collection agencies do not do those extraordinary collection actions. The two on the previous page are the two that I have on my screen currently. These are the two that the most collection agencies may do on your behalf. It's one, reporting to the credit bureau, and two, legal and judicial processes. So I think it's important to understand what is not extraordinary collection actions. So number one, what is not extraordinary collection actions is listing with a collection agency. At any time, you can list with a collection agency. 501R does not prevent you from listing with a collection agency. But understand, that is not extraordinary collection actions. Calling a patient by telephone, either by the hospital or the collection agency, is not an extraordinary collection actions. Writing off the account of bad debt is not an extraordinary collection actions. Sending a patient a bill is not extraordinary collection actions. Upfront collections for current care is not an extraordinary collection actions. But that one's extremely important. Notice how it says current care. So if I ask every single patient that comes in the door for $25 copay, it is not extraordinary collection actions. But the main but on this one is if your registration staff or admission staff is asking for previous care upfront collections on previous, patient owes $150 for previous care. So they went to the emergency room and still owe $150. If your registration or admission staff asks for that money, it is considered an extraordinary collection action. This is extremely important, especially in the days when facilities are starting to look to try to capture as much money as possible. When that patient comes into your facility, make sure your registration staff understands that they are doing extraordinary collection actions if they're asking for money for previous care. It's a complete 180 change from what I see many facilities trying to do. They try to collect it up front before services happen. And it's great if it's for current care, but if it's for previous care, it can be considered an extraordinary collection action. So like I said before, one of the most important parts of this is the reasonable efforts that go along with those extraordinary collection actions. I'm going to go through what their 5 reasonable efforts are and how to accomplish those 5 reasonable efforts in a timely and responsible manner. So reasonable effort number 1. The IRS in their final regulation release said that you have to send at least 3 bills/statements And the reason the IRS said at least 3 was based upon the typical billing cycle that commenters made in order for what the comments were on 501R. So you have to send at least 3 bills and statements in order to do your reasonable efforts. One of the other things I wanted to point to is because the IRS really pointed to the HFMA workflow. There was a HFMA patient financial services council that came together not too long ago, about 2 years ago, and they made a recommendation of at least 3. That's another area where the IRS did gather the reasonable efforts to send at least 3 bills or statements. What is required on those 3 bills or statements? There's one requirement for this, and that requirement is a conspicuous written notice. This is part of being widely publicized, that you have to have a conspicuous written notice on each and every one of those 3 statements. And that conspicuous written notice needs to contain information such as where a patient can receive assistance for financial assistance, the phone number, the direct telephone number where the person can receive assistance, and also the website address where copies may be obtained about financial assistance. And oh yes, that conspicuous written notice has to be a sufficient size and clearly readable. So a question you have to ask yourself, does every single one of my statements that is mailed out for patient balances have on there a statement such as, financial assistance is available to those who qualify. Please call with a telephone number or visit us online to learn more. So you have to put the website address. If you don't, you are not following the reasonable efforts, and I highly suggest that you start adding that to your statements, because it can take quite some time to make sure that your statement provider is having that conspicuous written notice on every single statement that goes out the door. Here's an example, the one that I talked to you just about not too long ago, what that conspicuous written notice is. Financial assistance available to those who qualify. Please call XXX or learn more at XX, the website address. Make sure a statement such as this is on every single one of your 3 billing statements. One question I commonly get about these 3 statements, and that question is, what about mail returns? Well, the IRS was smart enough to put in the 501R regulations that a notice is considered provided the date it was mailed, emailed, or hand-delivered. My strong recommendation for you is when you're writing your billing and collection policy to have a statement in there that says it is the patient's responsibility to provide the correct mailing address upon admissions or moving. If the patient does not provide a correct mailing address, the reasonable efforts will be considered completed. So that way, if the patient does not provide you with the correct mailing address and you get a mail return, it is considered the date that that first statement was mailed. So that's good news for you. So if it is mail return, just make sure your billing and collection policy addresses the mail returns as well. On this screen, you'll see what I mean by having a little bit of a comment about that. So this is where the suggestion comes in. In the red is what I would suggest that you have on your billing and collection policy, the statement down below. One of the things that the IRS did touch on too is the statement that, well, I don't mail statements, so is it okay to email them? And the IRS said, yes, it's okay. If you initiate a program to email or electronically provide any statements, if they prefer to receive electronic communication, there's no problems with that. So don't worry if you don't specifically mail statements. If you email them, it's just as good. Reasonable effort number 2. So reasonable effort number 2 is to provide a plain language summary in one post-discharge communication. In the original 501R regulation, it was required to have a plain language summary with every statement. The IRS clarified this in the final. It says that you only have to provide it in one post-discharge communication. So my suggestion to you, with a plain language summary, is to put it on the backer of your statements or with your final notice. And we're going to touch on final notice a little bit later on. But for those of you that don't know what a plain language summary is, a plain language summary is a simple explanation of what financial assistance is. It's a statement such as financial assistance available to those who qualify. It talks about how to qualify for financial assistance. So if you're using your federal poverty guidelines like most facilities do, that needs to be as part of your plain language summary as well. It also has to have some language such as how to apply for financial assistance. You really need the location of the direct website address where a person can obtain copies of the financial assistance policy and application itself. And you also need to have a physical location where a person can receive assistance on that plain language summary. You also need to talk about where free copies of the policy and application can be attained in person. So if they need to go to the admissions area of one local facility, that needs to be on the plain language summary as well. I found one great example of a plain language summary that I did put on the handout slides. I'm not going to go into Spectrum's website for that plain language summary, but if you're looking for a sample of a great plain language summary, take a look at the one that I had the link on the screen and go to it from the handouts. It's one that I would suggest to you to look at when you are creating a plain language summary if you have not created one already. So reasonable effort number 3. Reasonable effort number 3 is to make an oral communication. Did the hospital facility make a reasonable effort to orally notify patients before they do extraordinary collection actions, and at least 30 days before they intend to initiate? Now, a lot of facilities have asked me this question. Well, how do I do the oral communication? One of the things you have to make sure of with that oral communication is that you have to make sure that you at least attempt to communicate. You do not actually have to communicate with each and every patient. You just have to make one outbound phone attempt to communicate with them. So I get that question a lot. Do I have to speak with every patient? And the answer is no. You just have to make one outbound phone attempt and attempt to speak with that communication. There's 2 ways, in my opinion, to skin this cat. There's one, the live customer service team member making the outbound phone attempt. And number 2, there's agentless calls, just like your appointment reminders are currently probably already doing. So there's 2 ways to do this. Let's talk about the agentless calls first. One of the things you have to remember when you're doing agentless calls is that you are TCPA compliant. So part of this, and talking about financial assistance using a drop message or an appointment reminder, has some conflicting messages along with the TCPA requirements. And the reason there's conflicting messages comes down to that there cannot have any debt collection or financial content. And I'm sure someone would argue that financial assistance is about financial content. So make sure, and I'm going to be clear about this, make sure you get express permission from the patient if you're going to do the agentless calls, like an appointment reminder. Make sure the patients are signing something at the beginning of service or during the registration. Here's an example of what I'm going to talk about, the agentless calls. If you'd like more information about what that express permission means, please send me an email. I can give you some language to put in your admissions or registration contact. It's very important to have that in there, not only for the standpoint of doing your oral communications for reasonable efforts, but also because your collection agencies really do need that information included with the registration or admissions area, so they do not get sued for Telephone Consumer Protection Act. And if you don't know what Telephone Consumer Protection Act, it basically means that you cannot call a patient's cell phone unless you have express permission. And the only way to get express permission is in signature from the patient most of the time. So here's an example of an agentless call that I would suggest to you if you're looking to use one. Hi, this is XYZ Healthcare Facility Financial Assistance Counselors who can be reached at with a phone number. And we can offer financial assistance to those who qualify or are struggling to pay their medical bills. Press 1 now to talk to a financial assistance counselor today, or call us back at and then leave the phone number. This is an example that you can use recorded message that you can use in order to do your oral communications. There's something very important about this oral communications that you need to understand. A lot of clients have asked us to be able to make those oral communications for them on their behalf during our collection calls. And I remind them that the oral communications requires you to have the call about financial assistance and financial assistance alone. So if you're having your collection agency make a call and they're trying to collect a debt and they're mentioning, oh, by the way, financial assistance available by XYZ healthcare system, they're not technically making the oral communication on your behalf. Make sure the call is really about financial assistance. So let's talk about oral communications using live customer service team members. And if you use an extended business office, early out, or self-pay company to make the calls on your behalf, this is very easy for them to implement into every single one of your calls. So AmeriCollect does have a second facility or second organization that we work with. It's called AmeriEBO. It's our self-pay collection company. For those clients of ours, on every single call, we're saying financial assistance available to those who qualify. We're making the oral communication on every single call. Every single call, we're talking about financial assistance. It's important to understand that. If you're working with a third-party partner that does your self-pay calls on your behalf, ask them to add the financial assistance is available to qualify on every single call. This will allow you to accomplish your oral communications as well. Reasonable effort number 4. Reasonable effort number 4 is you have to mail a final notice. And that final notice needs to include the intended ECAs. A lot of facilities who do not currently send a final notice needs to create one in-house before it goes to your collection agency. Because that final notice also needs to mention that financial assistance is available. The second part of this sentence here is very important. Your final notice also needs to mention financial assistance is available. If you're having your collection agency send a notification, the final notice notification about the extraordinary collection actions, I guarantee they are not talking about your financial assistance program in there. It's important that you try to send your final notice yourself. The requirements of the final notice also have on it that you need to have a deadline date. And that deadline date can be no earlier than 30 days after the ECA initiation notice or final notice is sent. So your final notice needs to have a 30-day deadline. That's very important to have on there. Every final notice needs a 30-day deadline. I've seen many final notices of different facilities that are 14 days or 21 days. You need to make sure you update that final notice to give them at least 30 days. Let's talk about the intended ECAs and what those are and how to include those in your final notice. Down below is an example of one of our final notices that we're sending out in the name of our clients for our extended business office. It goes like this. According to our records, your account is seriously past due. If we do not hear from you from 30 days from the date of this letter, your account will refer to a collection agency. Please call us to mail in payment. We intend for our collection agency partner and at their discretion and with our approval to engage in extraordinary collection actions, including but not limited to reporting adverse information to the credit bureau agencies, or taking action that requires a legal or judicial process, including but not limited to civil action and garnishing an individual wages. Remember, your final notice has to list the intended extraordinary collection actions. And for the intended extraordinary collections, that's 1 and 2 below. You have to list those on your final notice. So one of the things that we're doing on the extended business office at Early Outside for many of our clients is we're including multiple episodes of care. One of the things the IRS did a poor job of is understanding that, especially in the healthcare environment, you have multiple episodes of care for a single patient. And sometimes you want to combine those multiple episodes of care to save on costs. And to do that, what we do is we're creating basically a form on the back of our final notices That form on the back of the final notices lists each and every individual extraordinary collection action date by the date of service. So that way we can combine multiple episodes of care and save money for our clients. So the first part of this notice is exactly the same. The second part is different in red, and that's we intend for our collection agent's partner at their discretion and with our approval to engage in the following extraordinary collection actions by the date listed on the reverse side of this notice, but not limited to, and again putting the intended extraordinary collection actions. When you do your final notice, if you want to group multiple episodes of care, you can if you have a table on the back of your notice listing the extraordinary collection action date for each and every episode of care. So we talked about what it means to do extraordinary, what are the extraordinary collection actions. We talked about the 4 reasonable efforts that go along with this. And now we're going to talk about the application period, or on the clock. And I think it's important, especially when you start talking about the application period, is to get kind of a breakdown, a chart of what it means to have an application period. I went over this last week as well, but I think it's important to go over again. So for those of you that that in the past used to send an account off to your collection agency, let's say at day 120, and that collection agency, once it's at the collection agency, they no longer accepted financial assistance applications. You can no longer do that. You have to accept an application from the date of discharge all the way to 240 days from the date of the first post-discharge statement. That's considered the application period. This entire time frame is considered your application period. And during that entire time frame, even when it's at your collection agency, is you have to be able to accept financial assistance applications. Your collection agency has to have the training in order to offer financial assistance applications to the patients. It's extremely important. If your collection agency is not offering your financial assistance, you can get in trouble and possibly lose your not-for-profit status. So make sure your collection agency understands that they need to send out financial assistance applications on your behalf. So let's talk about the application period. As I said before, it's the date 240 days after the hospital provides an individual with a first post-discharge billing statement. And that's for every single episode of care. So if the patient was seen a month ago and then seen again this month, those are different episodes of care. That date matters from where that first post-discharge statement was sent on each one of those dates of service. So remember, it's 240 days from the date of the first post-discharge billing statement for each and every episode of care. So during the application period, you need to understand what to do during this time frame, or the registry or the financial counselors really need to understand what to do. So we're going to go through what to do when you receive an application. So let's say an application comes in and you approve it. Now what? There's a requirement with 501R that you have to do something after an approved application. We're going to go through that. Let's talk about if it's the full amount. So let's say the patient is 100% qualified for financial assistance. We're going to go through what's the steps needs to follow. We're going to go through the steps that say less than the full amount. What if they're qualified for only 50% of financial assistance? What do you have to do? We're also going to go through what happens if it's denied. Now what? What do you need to do after an application is denied? We're also going to go through what happens when an application has missing information. Now what? What do you have to do after you have received the missing information? So let's start. You receive an application. What happens next? Number one, if it's at your collection agency, you need to immediately notify your collection agency. Your collection agency needs to put that account on hold. There has to be a process so that the collection agency does not continue collecting on it and does not do extraordinary collection actions. For us at AmeriCollect, we built a systematic process in place So as soon as we receive that hold notification, the first thing we do is we place the account on hold for 60 days. That hold needs to stay there until you make your determination about financial assistance. So make sure your collection agency has something in place to hold accounts. Step number 2, you need to make a determination, eligibility determination, in a timely manner. The IRS described that the application has to be made in a timely manner. The qualification has to be made in a timely manner for your financial assistance counselors. So my suggestion to you is have some sort of process in place to make sure how far behind your financial counselors are on approving applications. A timely manner is subjective in the way that any person can look at that. So if you're a month behind on your financial assistance applications, and most facilities are not, but it's one of those, if you are a month behind, it's important to understand that somebody may consider that not a timely manner. Step number 3, you need to document the determination. Where will you document the determination about financial assistance? It has to be documented somewhere according to 501R. And step number 4, you will need to notify the responsible individual in writing of your determination. It doesn't matter what the determination is, you have to notify the responsible individual in writing. That's extremely important with this. In the past, I've known some facilities that did not always send something in writing to the patient of their determination. In this instance, in 501R, and now it's best practices too, but you have to now. It's required of you by law. So as I said, what happens if the account is approved? Well, the first thing you have to do is if it's approved for free care underneath your financial assistance, you're going to have to notify the individual in writing. So the first thing you have to do is send out a letter to the patient. The second thing you have to do, if the patient has made any payment on that account and the threshold is $5 or greater, you have to refund the patient. So if the patient made a $25 copay at the time of service, you will have to refund that patient if you qualified for free care. Step number 3, you really need to notify your collection agency immediately upon approval. That way your collection agency can cancel the account back to you with financial assistance. So make sure you notify your collection agency if it's at your collection agency. Let's talk about if it's approved for less than the full amount. The first thing you have to do with everything else, I told you this before, is that you have to notify the individual. So you'll have to send a letter out to the individual telling them that they were approved in less than the full amount. Step number 2, you either have to give the patient at least 30 days to pay before doing extraordinary collection actions, or send them a notice and giving them 30 days to pay in full. So let's say they qualified for a 50% discount. That 50% discount has to be sent to that patient, notifying that they were approved, and give them 30 days to pay in full before doing any extraordinary collection actions. Even if you've already sent a final notice on this account, you will need to send a second final notice. And then, of course, you have to notify your collection agency if it's at the collection agency that was approved in less than the full amount. Because that collection agency is going to have to do a little bit of work on their end in order to adjusting the balance and make sure that they have the same exact balance along with yours. Let's talk about if it's not approved. Let's say the patient turns in the application at day 239 and it's not approved. The first thing you have to do is you have to send a final notice to that patient, giving them 30 days to pay in full before doing extraordinary collection actions again. That final notice also needs to be accompanied by a plain language summary again. So you'll have to mail another final notice to any applicant that is not approved. And then again, you're going to have to notify your collection agency again as well. So let's talk about if the application comes in and you're missing information. If there's missing information on that financial assistance application, the first thing you have to do is you have to notify that patient. Seeing a trend here? It's notify the patient. It's the first step in all these things. As soon as the application comes in, either you approve, deny, or missing information, you have to notify the patient. Along with that notification to the patient, especially with missing information, you have to notify them that they have 30 days before extraordinary collection actions can resume. And again, if it's missing information, you have to notify your collection agency and let them know that it was missing information. And they can continue their collection actions after 30 days. Let's talk about what it means to approve in a timely manner. As I said before, it's a subjective word, timely manner. One of the things the IRS did clarify in the final regulation, it allows you to ask the patient to qualify for, let's say, Medicaid, disability, or some other determination for care before you approve a financial assistance application. So let's say your policy says that they have to at least apply for Medicaid before they can be approved for financial assistance. This allows you to extend that timely manner so that they can have to apply for Medicaid first. One of the other requirements under, let's say, Medicare bad debt is that you have to document each and every responsible party, that you're performing it the same exact way. The good news is that the IRS does not require you to document, like Medicare bad debt, everything that happens on the account. All the IRS said is that you have to make sure that you have the policies in place and that you are doing the efforts that your policies say you are doing. So you do not have to document each and every single account of your reasonable efforts. That's great news. Something you want to be careful about, especially with 501R, is that you are held liable for the ECAs that your debt collection agency does, or debt buyers. It's a very important piece of this, that you are held liable for each and every one of your collection agencies. If they do not understand 501R, you could lose your not-for-profit status. Make sure you're working with a collection agency that completely understands 501R, because it's very important for you to do, or for them to understand 501R and how to make sure that those individuals that are financially struggling are receiving financial assistance application via email or mail when the collection agency is working with them. It's extremely important. Along with that, you have to have a contract in place with your collection agency. 501R requires that every single one of your collection agencies have a contract in place. And there's a few things that you need in that contract. Number one I would suggest is that your collection agency really disclose all failures. So if they were to accidentally place an extraordinary collection action on a patient before they should have taken extraordinary collection actions, they should disclose that failure to you. Number two, have some sort of language in your collection agency contract that talks about the reasonable effort determinations. They can make those reasonable effort determinations on your behalf, but it's important to have it in there if you're going to allow them to make those reasonable efforts on your behalf. Number three, in your collection agency contract, make sure you have something in there that talks about when they should do extraordinary collection actions and what extraordinary collection actions they can do. So if you're asking your collection agency to only do extraordinary collection actions such as credit bureau reporting, then that needs. Now, if you're asking your collection agency to do legal or judicial action, that also needs to be in that collection agency contract. That we wait till after the 240 days to do legal or judicial action. Number four, who's going to refund the patient if there's an approved financial assistance application? Most of the time it's the hospital that does the refunds, but it does need to be in your financial or in your collection agency contract as well. Number five, you need to talk about in that collection agency contract how long the agency should suspend the extraordinary collection actions when they in the application period. So if an application does come in, how long should they suspend their work events? Number six, you should really talk about who's going to send a financial assistance application to the patient and who's going to document it in your system. These are the 6 things that you really should have in any collection agency contract. The final thing that we're going to cover today is your billing and collection policy. The IRS requires you to have a billing and collection policy. You can do it of one of two ways. You can update your financial assistance policy to contain your billing and collection policy, or you can create a separate billing and collection policy. If you have not created or do not have a billing and collection policy, and most facilities do have a billing and collection policies, I do have a free copy available for you. We have created a billing and collection policy that has been reviewed by many different facilities, and many different facilities are utilizing it. So if you're looking to obtain a copy of our billing and collection policy, you just click on the link in the handouts and you'll be able to get a free copy of a billing and collection policy. Let's talk about what needs to be in that billing and collection policy. There's really 6 requirements to have in that new billing and collection policies. Step number 1, you have to describe the actions that the hospital will take. Number 2, you have to describe the actions that your collection partners will take, including what extraordinary collection actions you're going to allow of them. But it can't just be limited to the extraordinary collection actions. So if you're allowing your collection agencies to make phone attempts on your behalf, that should be in your billing and collection policy. Step number 3, you must describe the time frames that the hospital is going to take any of these actions in 1 and 2. Step number 4, you have to include all those reasonable efforts, the 3 statements, when the plain language summary is going to be mailed, the oral communication, and then finally the final notice. That needs to be in your billing and collection policies. Step number 5, you need to describe the office and department with final approval or authority approval. And 6, where an individual can obtain copies, free copies of the billing and collection policy. Thank you for everyone who joined me today in discussing 501R4 and 501R6. It doesn't look like I have any questions at this point, and if I do have questions, what I'm going to do, if any questions come in after this, please feel free to, I'll reply to you via email if there are any questions. Ooh, it looks like I do have one. And the question is, do we have to send 3 letters in addition to the statements we send, or do the statements count? And the answer to that question is yes. You do have to, well, the answer to that question is no, you don't have to send 3 additional letters. Those 3 letters count. So the letters, statements, notices, whatever way you use to explain. You only have to send 3 written communications or electronic communications. And it can count as what you currently already do. Since there are no other questions, I thank you very much for joining me. And if you do have any questions, like I said, feel free to email me. My phone number and my email address is on the screen. If you would like me to review your policies, again, please send them over to me. If they're free of charge, I'll review them for you, give you some suggestions. But again, thank you for joining me today.